This is an Innovation Support Unit video on team mapping. I'm Morgan Price, and I'm a member of the Innovation Support Unit, and I'm going to go through just a quick introduction to what is team mapping today. In this video, we're going to talk about an overview of the basic process of team mapping and why we do it. And while listening, I hope you consider how it might be helpful to use this when you're working with a team. This video is directed at people who are going to be facilitators in team mapping and support members of team-based primary care. So what is team mapping? Let's start there. It's a facilitated workshop for a primary care team where the team works together to decide how they want to support patient care going forward. So they're working together on how they want to work together. We do this and we map it onto a big map. The patient is in the center and Post-it notes fly everywhere when we're doing it in person. When we're doing it virtually, which we've been doing a lot more in this last year, we do it on a shared screen. Post-it notes fly around as well, but it's a little more controlled and it's easier to read. Why do we do this? Well, creating a team and an effective team is hard work. It's a complex thing to do well, and we need to support the implementation of teams to help accelerate that team development. It's hard to create an effective team or an appropriate team. If you don't know who you should hire, what professions should be part of a team, team mapping can help work on that decision. And if you've already decided who's part of the team mapping can help the team work better together. It does this by helping teams explore how to better meet the population needs of the patients that they're serving. And it gets people together on the same page. And literally when we're in person, of course, and then virtually when we're doing this all through shared screen. While we talk about the mapping, it helps everyone explore assumptions and look at different options for how to work together in different scenarios. And it's designed to be fun. It's important and sometimes difficult work, but there's a little bit of a lightheartedness in the facilitation as well. So how does this work? You've seen the maps, but how do we get there? We're going to go into a lot of detail on this over the videos and the training program, but to give you a quick orientation to this, a facilitator will use a patient persona to explore common care and care coordination issues. And by the way, that's you as the facilitator, or will be, as you go through the training program. You will facilitate, and the team will discuss and prototype how they might want to work together to support that patient. We keep things very patient-focused, and that drives the conversation. The personas are simulated cases. They're simulated to be realistic, but they aren't real people. You will select them, and we'll tell you about that later, to reflect the local needs of the practice. Generally, the persona that we have are also a little more complex because they're designed to highlight areas where team-based care is important. Together, the team will fill in a circle of care for the persona that they discuss and for each persona that they discuss, deciding together how care can be better delivered. And you, as the facilitator, will prompt with different questions and introduce new scenarios for those persona. To be successful, you want to encourage the team to consider what their realistic future is, and you'll determine what's realistic during the preparation stage. But I often find I need to sort of push people to think beyond what is today to what could be tomorrow. And that's where the prototyping happens. As the team discusses, the different ideas are then captured and refined on the map so people can see what they've said and see what decisions have been made. And this includes the different roles, the tasks that those roles might do, and any gaps that you want to follow up on or the team wants to follow up on later on. The benefits that we've seen for team mapping, they really depend on where the team is. We've done this now with hundreds of people across the province of British Columbia, And we've used it at multiple stages of team formation in different environments, from urgent primary care centers to community health centers to outreach teams to family physician offices and patient medical homes. The benefits depend on where the team is in terms of its stage of development. If the team is just in the planning stage, it's about who's on the bus, who's going to be on the team, what professions do you want to consider hiring into the team. And that's a very different proposition than if you've already made that decision. So if you already know and you're just starting to work together as a team, you're in the forming stage. And now it's about understanding how you want to work together. It's about getting to know each other, understanding where your personal skills and interests are as clinicians. So the benefits here are understanding how you want to divide up different kinds of work across the team members and across the different professions in the team. And through that discussion, you're going to learn that I happen to really like giving immunizations, or I did some extra training, or I used to be an emerge nurse. And then you can really tailor how the practice operates. And it's fantastic to see when teams start to think about this, because then they start to really gel. The third group are those that are established. They're not sort of a couple weeks into being a team or even a couple months. They're now a year or more, and they're established. And oftentimes we use team mapping here in a much more surgical, precise way to talk about a particular question. How do we want to onboard new patients? Let's just look at that as opposed to how we want to work together more generally. So an established team might look at exploring and prototyping a new piece of the practice versus looking at the whole practice. So you can use it in planning, trying to understand who should be part of the team, forming, how does the team want to work more generally, and then when you're more established, thinking about particular specific questions. The other videos in this series are going to get into the mechanics of team mapping, so don't worry, we're going to get into the weeds pretty quick here. Thank you.